Welcome back once again. It's a pleasure to have you again today, and thank you for visiting our channel. Today we are going to be talking about another big problem of non-communicable disease, and that is nothing other than diabetes mellitus, also called high blood sugar. This high blood sugar comes in many forms, but today I'm mainly going to talk about 3 types. I'm going to talk, this largely depends on who has it and when they got it. So these days we define high blood sugar when you have excessive sugar in your body and the body is not able to use it and it ends up becoming a problem. So really what happens here is that we have what is called type 1 diabetes. This type 1 diabetes basically comes from the fact that your body or the person's body is not able to produce enough insulin. When we are talking about high blood sugar, we have to put into context 3 aspects. 1 is the food, where the sugar comes from. 2 is the way the body utilizes this food. So we have a small organ in our bodies called the pancreas. This small organ called the pancreas is the one that produces a small messenger called insulin. This insulin comes and now it is stimulated when we eat things that contain a lot of sugar. So it works in collaboration with our liver. The liver is a big organ and it is able to take up the sugar and store it. But before our bodies act, we actually need this sugar for our muscles to work. So the other organ that comes into play is actually our muscles. But there's also another organ which is less understood, and that's the fat cells in the body. So these organs interact together to be able to use the food when we eat it. So the food that generates more sugar is actually what we call the carbohydrates. So when we take in a meal, for instance, if we take in a chapati, if we take in Irish potatoes, or when we take in for instance, rice, this goes into our bodies and it is ultimately converted into what we call glucose. This glucose now has to be broken down and utilized. If the body is not able to use this sugar very well, the sugar accumulates in the body and then it begins to cause problems. These problems are very vast. We have over 20 complications of the blood sugar. So if the problem is with the pancreas, we call that type 1. But sometimes the high blood sugar comes from our lifestyle. For instance, when we eat a lot of carbohydrates, when we don't exercise to use our muscles, when the liver stores up the sugar and the excess accumulates, or when we have a lot of fat cells, which is usually obesity, then we have what is usually called type 2 diabetes. The other form of diabetes, actually, we get it when we get pregnant. When you get pregnant, you no longer have your own self, but you also have a child to feed. So sometimes gestational diabetes comes with the challenges of getting pregnant. So high blood sugar is very common also, especially in people from low-income countries like Uganda. People have a higher burden of this diabetes. What brings diabetes, which is type 2, occurs in majority of people, is actually our lifestyles. Again, you remember we are talking about non-communicable diseases. These are diseases which are not transmitted from one person to another, as opposed to other diseases which are infectious, like malaria coming from parasites, or like diarrhea, which come from our behaviors and what we eat and bacteria. These ones are not transmitted from one person to another. So they largely depend on whether we do enough exercise, what we eat. If we eat things that contain a lot of sugar, things like sodas, packed fruits, if we take tea and we add in sugar itself, these things actually increase our risk of developing high blood sugar. So people with high blood sugar usually present in different ways. But talking about type 2, these individuals usually present with passing a lot of urine. If you pass urine more than 3 times a day, or if you wake up more than 2 times at night, you might actually have high blood sugar. And that is because the sugar gets concentrated in your urine and the urine pulls the water, so you have to pass it out. Other times, people present with what we call polydipsia. they have a lot of hunger. You are eating a lot, but you are never gaining weight. So we usually call them the 3 Ps. And then they also have polyphagia. You want a lot of food. And then they also present with other, what we call the 3 Ws. They might have wasting, they might actually have weakness. And so these things can present in these individuals. In the past, when people used to diagnose high blood sugar, you pass urine and the insects come to eat the sugar, you would know that you have sugar. But these days, we have modern science where high blood sugar can easily be diagnosed by a doctor. You give, they take your blood and they are able to measure this blood sugar. Once they find that your blood sugar is high, it can be either fasting, it can be a random sugar, or they can use another test called the hemoglobin A1C. Once those are elevated, the doctors can actually be able to tell you that ultimately you have this high blood sugar. This high blood sugar can cause a lot of complications. It can cause blindness, it can cause loss of limbs, it can cause loss of babies, it can cause numbness of your feet, and actually it can actually devastate your life. So it is very important that you learn the lifestyles that prevent high blood sugar, and these are highly through exercise, diet, making sure that you don't sit a lot, but more importantly, what you eat. These nice things, the so-called the foods of the rich, burgers, the chips, those are the ones that actually contain a lot of sugar and might increase your risk of getting this diabetes. So again, like we talked of hypertension, you can avoid high blood sugar by making sure that your diet consists of vegetables, the fruits which are not so sweet. Try to avoid artificial sweeteners and foods. Try to eat the natural foods. Try to make sure that your plate contains a lot of fruits and vegetables, and you minimize the proteins, and you also minimize the carbohydrates particularly. So I hope that as we move forward, you've learned a few things that are going to help you to try and prevent diabetes.